Are you all able to see my PPT?
No, ma'am, not yet.
No, ma'am.
Not yet, no? Okay, so I guess ऋतुजा तुझं brachial plexus झालं, right?
Yes, ma'am.
We have done that. So we are done with our brachial plexus presentation also and Erb's palsy also. So you do you all have any doubts in Erb's palsy, pediatric? If not, then I will start with this neuropathy.
No, ma'am.
Which I thought I have taken this lecture with you all. We had not done this. Hello.
No, ma'am.
Okay.
No, ma'am.
We'll just, this is a very small topic because see, most of the times what happens is what inflammatory or any infectious disorders of the brain like meningitis or encephalitis, they will lead to some complication like stroke. You know, most of the time it is going to be stroke or some compressive problem like TI. So those conditions you already have learnt separately in detail. So we will just kind of just go through all the complications that can happen with meningitis and encephalitis, and obviously treatment for those problems you already know because it will depend upon the sequelae or complication that develops later in the child, in that person. Am I clear with this? Okay, so there is no separate or specific management for meningitis or encephalitis. It will be dependent upon whether the person landed up having coma, whether the person landed up having some stroke, or he landed up having some monoplegia or whatever. Okay, so it would be management of that symptom or that condition. So let's just go ahead. As the name itself is self-explanatory, most of the inflammatory and infectious disorders of the brain means some inflammation of your coverings of the brain or inflammation of the brain matter, which is going to lead to some swelling onto your brain or some inflammatory condition, which will cause either a compression or destruction of your tissue, which will lead to some complications in future. Okay. So by the end of this session, you all should be able to classify the inflammatory and infectious disorders of the brain. This you have done in your third year also, I guess. Yes or no?
Yes, ma'am.
Okay. You should be able to differentiate between what is meningitis and what is encephalitis, which I will tell you. You should be able to discuss the pathophysiology, the complications, and what all disorders are associated with meningitis or encephalitis. And you should be able to discuss medical and physiotherapy management for these conditions. Now, we are not going to go into details of medical management, but physiotherapy management we will definitely try to cover up, and as I told you, it is mostly going to be of the symptoms or sequelae that are developed in that patient. Okay. So this is the classification of your inflammatory disorders. This you have done, this I have taken from your medicine book, this you have done in your third year also, correct? So there can be abscess, which may be because of any penetrating wound or extension of the local infection or any hematogenous complication, or it may be because of your compromised immune system. Say for example, I have TB, correct, which can lead to abscess. You can have meningitis, which may be bacterial or aseptic or viral, or you may have encephalitis. So encephalitis may be acute viral, like for example herpes infection. You may have some acute toxic uh, encephalitis, which mostly would be some systematic infection. You may have progressive viral encephalitis.